So that's the fertilization process of the sperm. Now, as I said a minute ago, not all of what is ejaculated is sperm. Actually, only about 20% is sperm. We call it semen because it's a compilation of a variety of substances that come from two glands, the seminal vesicles and the prostate gland. Okay? Seminal vesicles and the prostate gland are inside the body cavity, just above the base of the penis. The penis is half inside the body cavity and half out, so the erectile tissues can support the erection. But these two glands play a key role in the production of what we call semen. They produce and store liquid that as the sperm travel through, the sperm initiate or cause these glands to secrete their liquids as they pass through it, combining with the sperm to produce semen. And if you look on your outline there, the seminal vesicles comprise about 60% of the fluid called semen. It's made up of an alkaline fluid that helps neutralize the acidity of the vagina, so it's not quite so terrible a place for the sperm. It's about 1.1% saline for osmotic balance. Most body fluids are 0.9, salt. Fructose, food for the sperm, about 5 calories worth. Prostaglandins, hormones that stimulate male and female muscle contractions to help keep the sperm in the vaginal canal. And fibrinogen. Now, where did you hear of fibrinogen before? Clotting of the blood, right? Good. Helps sperm to clot when ejaculated. So what happens after ejaculation, this fibrin mat forms around the sperm or around the semen and keeps it clotted for 20 to 30 minutes. And then it begins to break down, allowing the sperm to enter the cervix and into the uterus and then up to the uterine tube to find the awaiting egg, hopefully. So all of those substances come from the seminal vesicles. Then as the sperm pass through there and collect that fluid, they then pass through the prostate. The prostate produces 20 to 30% of the semen. And two things are there: seminal plasm, which is an antibiotic, which is slightly acidic, which protects the sperm and the egg from bacterial infection, and citrate, which helps the production of ATP by the sperm to increase their motility. So all of those combine with the sperm and then go through the ejaculatory duct into the urethra and then out through the urethra. So these are the two glands that produce that. And, there's a lot of prostate cancer issues these days because that's a cancer that's on the uptick. And there's many different kinds of prostate cancer, many of which are very slow growing. And in many cases, it's probably not a good idea to operate on a patient, depending on the age and the type of prostate cancer. But if it's a very aggressive form, they have to remove the prostate. And it's a very delicate operation, as you can very well see. First of all, this is the path that the sperm take here. All right? This is the path that the urine takes here. And all the nerves and nerve endings to the penis and the testicles are right in this area as well. So when they first started doing prostate surgery, they weren't having very good success because there are a lot of side effects, like men could no longer get erections, or they could no longer have feeling, or they had problems with their urinary tract and all these other things because everything's so closely knit. The surgery has gotten extraordinarily much better now. It's much more reliable. But like I said, depending on the type of prostate cancer, some prostate cancers take 30 years to become lethal, and if you're 65 years old and you got that kind of cancer, chances are you're going to die of something else, and it might not be a good idea to risk the surgery. So anyway, it's because of the location of the prostate that surgery is a little bit on the risky side. There's a third gland here called the bulbourethral gland. Now, it is not part of what's ejaculated at all. It functions on its own. It contains mostly a lubricant mucus type of solution. And it is generally what you find in pre-ejaculatory fluid. The function of the bulbourethral gland is to secrete prior to ejaculation during erection process to lubricate the glands of the penis to make it easier to penetrate the vagina. So that's the function of the bulbourethral gland, not part of what's ejaculated typically. But that doesn't necessarily mean that pre-ejaculatory fluid is always from the bulbourethral gland. It might not be so. Keep that in mind. Now, the penis, as you can see, is half inside the body cavity, half outside the body cavity. There's a covering over the head. The head's called the glans, called the prepuce. That's what's typically removed surgically, called in a circumcision. That's not typically done in most countries. It is done in some religions. It is done in some cultures. But it's not typically done in most countries other than this one. And there is now some developing skepticism if that's a good idea or not. So you might want to investigate that if you're going to have a male child before you decide just to do it, unless, of course, it's a religious concern or something like that.
They used to just do it before, back in the day, but now you give an option, and you
Right.
have to pay for it now to have it done. Yeah, it's an
Well,
option.
you know, there's risk to all surgeries, and there's some risk to that. The reason for circumcision in this country was hygiene, but because hygiene has improved so much, that is not such a big issue anymore. So it's worth looking into. That's all I'll say about it. Okay, other parts of the penis. If you look at the cross section of the penis here, you'll see it's mostly made of what's called the corpora cavernosa. That's what engorges with blood, causing the erection. There's blood vessels, of course, supplying that blood. But there's also the corpus spongiosum, which is another type of tissue that surrounds the urethra. And the corpus spongiosum is very tough and very resistant to compression. So when a male gets an erection, the urethra doesn't crimp closed. So the corpus spongiosum keeps the urethra open. Why is that important? For ejaculation, right. If the urethra was pinched closed during an erection, you wouldn't be able to ejaculate because that's where the sperm come out of. That's where the semen come through, is the urethra. So during an erection, when the corpora cavernosa engorged with blood, they put a lot of pressure on the urethra, but the corpus spongiosum resists that pressure. Here's the bulbourethral gland at the base of the erectile tissues. During the erection process, the autonomic nervous system now is in charge of both erection and orgasm, or erection and ejaculation. Okay? It's the parasympathetic in the erection process. It's the sympathetic in orgasm or ejaculation. So there's a shift between those two autonomic nervous system sides to achieve these two processes. And yes, they are different processes, as I was asked. When was it? I can't remember. Anyway. Erection is a parasympathetic response. Due to visual cues or other types of stimulation, what begins to happen is nitric oxide, not nitrous oxide, laughing gas, but nitric oxide is released in the arteries that feed the erectile tissues of the penis. Nitric oxide is a vasodilator. It dilates the arteries going to the penis, increasing the blood flow. As blood enters the corpora cavernosa, it begins engorging with blood, and that begins to build up pressure, and that pinches off the venous return, or the veins that are sending the blood back to the rest of the body, which traps the blood in the penis, enabling an erection to occur. So, where was I here? Yeah, I think I covered that. All right. Then, once an erection has occurred, then there's a shift in the autonomic nervous system to the sympathetic nervous system for the process of ejaculation. And to illustrate that, I need this back here. Ejaculation involves peristaltic contractions. Now, where have you heard peristaltic contractions? Okay. There's a difference, okay, and that's time frame. Peristaltic contractions in the digestive tract take 8 hours. Peristaltic contractions in ejaculation move at warp speed, I mean really fast. It begins all the way down here in the testicles, in the epididymis, propelling the sperm into the vas deferens. Okay? Vas deferens then pass through the seminal vesicles. They secrete their fluid. Prostate secretes its fluid. The urethral sphincter is shut off during the end of the erection process, the beginning of the ejaculation process, so that urea isn't part of what's ejaculated. Only semen is ejaculated. Peristaltic contractions of smooth muscles, the testicular ducts, the epididymis, the vas deferens, the seminal vesicles, the prostate, the ejaculatory duct, and the urethra, all sequentially, propelling 2 to 5 milliliters of semen at about 250 to 500 million sperm at the rate of about 200 inches per second. So it comes out quite quickly. Simultaneous release of a large dose of endorphins, creating a great sense of pleasure. So why do we have this huge dose of endorphins during ejaculation or orgasm?
Because you're releasing endorphins?
Well, because of that, what does that cause you want to do? It encourages you to have sex, because reproduction is the most important process as far as your evolution goes, to pass on your genes to another generation. So you get a small dose of endorphins when you urinate, you get a small dose of endorphins when you defecate, but you get a big dose of endorphins when you have sex or have an orgasm or ejaculate. So it's rewarding you for producing more offspring. Any questions about that? Okay, tomorrow we'll go through the female reproductive system, and I'll begin to, when we do that, as we go through it, make some relationships between the structures in the male and the female systems. But we've got to be able to go through them both before we can do those comparisons. So we'll do that tomorrow. But we're way ahead of schedule, so we're in good shape.